Good evening, everyone, and thank you for joining us again tonight. My name is Tanya, and I'm one of the wound and ostomy care nurses here at the University of Miami Hospital and Clinics. It is my pleasure to be your host for tonight's support group session. But before I introduce our guest speakers, I did want to mention that during the session, you do have the opportunity to submit your questions and comments in the chat box. It's located on the bottom of your screen. You can also get the chance to ask a question or even make a comment by clicking on the raise your hand option. It is also located on the bottom of your screen on the reactions tab. We will get to all the questions at the end of the presentation. I am very excited about tonight's presentation. I think that it only seems fitting considering that we are in the month of love. We are doing things a little bit different. We will be having two guest speakers. So let me introduce you to the first speaker. Her name is Dr. Amy Crowley. She has a very impressive background. It all began in May of 1998 when she received her Associates in Arts in Human Services from Hagerstown Community College. She continued her education and in May of 2000, obtained her Bachelor's of Arts in Psychology. Quickly furthering her education and her career, she got her Bachelor's of Science in Mental Health, Counseling, and then her Doctor's in Education and Counselor Education and Supervision. Dr. Crowley has a number of certifications and licensures, ranging from being a national certified counselor to licensed professional counselor to a master's level certified addiction professional. As an integrative therapist, her approaches for treatment from a multidimensional, non-judgmental perspective. She believes in allowing...
Yes, exactly. Thank you very much.
So she believes in allowing the patient to guide as they best know the issues they face daily. She provides clients with an atmosphere of acceptance and safety, knowing they are meeting with a qualified professional who is interested in helping them become the best they can be. She offers individualized treatments, allowing for goal setting specific to the needs of the presented patient. Our second speaker is Nicole Goldschmidt. Nicole is a licensed physical therapist assistant, successfully obtaining her Associates of Applied Science in Physical Therapy Assisting in December of 2018. Between the years of 2019 and 2021, she worked as a licensed PTA in Tampa. Moving her way to much colder weather, she is now working as a business systems analyst in Virginia while studying for a bachelor's in information technology from Liberty University. Her input tonight will be from a different perspective in which I think that many of you can relate. Hi, ladies, and happy February.
Thank you. We are very grateful to be here. I first want to thank you, Tanya, and I also would like to thank Stephanie. I see she's on the call as well, for reaching out to me and inviting me to have this opportunity to speak to everyone here this evening. I also want to thank Nicole for her willingness to come with me this evening and also speak to you from her unique perspective, which I would agree with you, Tanya. I do believe that the audience tonight will certainly appreciate what she brings to our presentation. So I will go ahead and share my screen so that we can all see the presentation. And certainly if there is any difficulty in seeing it, let me know. Is it visible to everyone?
Yes, we're able to see it.
Awesome. Okay. So let me just stop for a minute. I have shared this presentation with Tanya. So our contact information is listed here. Certainly you can feel free to share that with the audience or other members of the support group in case they may wish to reach out to us. Okay, there we go. All right. It keeps telling me I'm muted. Can you hear me?
Mm-hmm.
Okay, all right. I keep seeing you're muted, so I wanted to make sure. All right. So I do just want to briefly go over the the introduction. So I do appreciate all the information that you shared, Tanya. Just a little bit of extra information about me. I do own Infinity Counseling Services, LLC. That is my private practice where I see clients on a regular basis. I carry a higher caseload than I probably should, but I really do enjoy my identity as a professional counselor and want to make sure that I stay active in the field of counseling so that I can bring that information back to my students, as I am a full-time associate professor at the Chicago School of Professional Psychology in our clinical mental health counseling program. So it is important that I have that real world experience to share with my students. One of the courses that I teach is human sexuality. And right now I'm actually teaching the class, and it is a wonderful opportunity for me to share about everything that makes us sexual beings. And for many individuals, that's a very touchy subject. It's a little bit of a taboo topic. They're not always sure how to talk about it. So I really try hard to educate our students on the vast array of sexual behaviors outside of those that we might either know ourselves personally, have dug around and figured out, on our own, since we're not likely to have a lot of conversations at home about this as we're growing up, or that they think they know, and then we find out that they may not necessarily know correctly. From a therapist perspective, I am a sex positive therapist. So I do welcome all conversations that have to pertain to sex and sexuality. I set an environment for my clients where they can be comfortable speaking to me on these topics. Because it is such a innate human drive that we all have. It is one of the most natural behaviors that mammals participate in. And that includes not only human beings, but also many other mammals, that we really need to demystify it, and we need to normalize sexual experiences. So for me, I create that environment where clients, students can come and they can have conversations with me without fear of judgment, discrimination, or even ridicule for some of the questions that they might bring. And then just as a final note, my practice is a gender and sexuality affirming practice. The co-owner of my practice is my spouse, who identifies as a trans man and is also a licensed mental health counselor here in the state of Florida. So together we have a practice that kind of caters to our LGBT community, but also to working with those with histories of sexual trauma, sexual concerns, questions, sexual dysfunction. So we both have an extensive amount of training in this area. So it was wonderful to hear from Stephanie that this was an opportunity that I would have to speak to everyone this evening. Nicole, would you like to say a little bit more about yourself?
Yes, absolutely. Thank you, Amy. And I'd like to thank the University of Miami as well for having me here. My name is Nicole. I'm a full-time BSA, full-time online student, and a full-time Ostomate. I have had the unique experience of having an ostomy twice in my life. I was diagnosed with UC when I was 10, and it quickly progressed or regressed to need a total colectomy when I was 13. So I had an ostomy for the course of 4 months before I was reconnected to my J pouch. My life was drastically improved from my surgery, but I always dealt with chronic pouchitis. And in 2020, my symptoms started to become more complicated, and I was advised to have my J pouch taken out and be diverted again. And I think it is important to know, I think we all kind of know that everyone with this sort of condition, it's all very different. No one has the same symptoms. And so I am able to have a new J pouch because the small intestine above my J pouch looked normal. So I was able to find a surgeon who was willing to create a new J pouch for me and divert me for a while I'm in the healing stage, which is where I'm at now. So my first experience with an ostomy at 13 wasn't great. And I was really young and I didn't have the best support. And I had a lot of difficulty managing my bag and minimizing skin breakdown. And I also had a lot of anxiety and insecurities about my body. So much so that I was really terrified to go through with this surgery again as an adult and potentially have to keep my bag forever. But it really wasn't a question of if I needed the surgery, it was a question of when I would accept it. So what I did to kind of come to terms with my condition was that I sought out a therapist to help me navigate these problems and doubts before my surgery actually happened, who is Amy. And she has been nothing short of instrumental for me in this process. So here I am, I'm 8 months post-op, and I never thought if you asked me 8 months ago, I would feel comfortable speaking to a group, but I am overjoyed to be here and speaking on this topic today.
Thank you, Nicole. I appreciate that. Appreciate you giving a little bit of additional information to our audience as well. So let's go ahead and get started. We are first going to talk about what is health sexuality. And so in order to sort of break this down, I do want to kind of go back a little bit and talk about human sexuality again. So human sexuality is grounded in biological functioning. So what we are at our biological level, it is a action that we engage in with either ourselves or another person that meets our some of our basic needs. And if we're looking at Maslow's hierarchy. So this sort of emerges in all of us as we develop over time. And by time, I mean, even from prenatal, we are sexual beings in the uterus. It is not uncommon for us to witness infants and children and then adolescents who explore their own bodies, who learn about sexuality and what feels good by simply touching themselves or rubbing against something. It is something we discover more than we're educated on. And again, that has to do with sort of the underlying theme of our society that sex is taboo. And so we don't talk about it. We keep it very hidden. And unfortunately, that keeps people from seeking out resources and information that they really do need to help them understand their sexuality. In the case of our audience today, our ostomates and their caregivers, there's even more complexities to it. So if we're struggling to get past the barrier of what is sexuality, it's going to be even more complicated when we start adding the additional layers of our health issues or the health issues of those we're caring for. Health or human sexuality is expressed differently through various cultures, and they express it through different rules. Some of those may pertain to what is acceptable and not acceptable for sexual contact, attitudes about what's moral or immoral, and habits of sexual behavior, things like patterns of relationships that we're in, the types of relationship dynamics that we may find ourselves in, and even so far as to say whether or not sexual intercourse is appropriate. Although sexual intercourse is common amongst the animal kingdom, specifically mammals, sexuality is something that is unique to humans. So this goes beyond just our sexual drive and has more to do with our conceptualization of sexuality as a complex process and not just an act of physically having sex. The United States is often thought of as a repressed society when it comes to sexuality, yet images of sexuality are around us in infinite numbers every single day. So it's sort of an oxymoron that we're not going to talk about it, but let's go ahead and put up some pictures about it. Let's go ahead and, support those events where individuals are scantily dressed, but we don't want to talk about sex. That's something totally different. So it can be even more of a misnomer that there's something here worthy of talking about when we're not even willing to, appropriately share images that also support our society's view on human sexuality. So now I want to talk just for a moment about health sexuality. So health sexuality is a state of physical, emotional, mental, and social well-being that is related to sexuality. So we're looking at what contributes to our well-being and is sexual in nature. Now, ideally, these would all be positive things. However, there are times when our health our body does create a negative experience for us or a barrier that we have to work to overcome. The other thing is to know that health sexuality is not the absence of disease. And that's something that individuals are like, well, if I have no diagnosis, if I have no medical conditions, then I'm healthy. Well, there's a lot more to this than just being healthy. And so we really want to sort of keep things separated so that we understand that you don't have to be healthy to be sexual, that there are many other ways to be sexual, to express our sexuality, even if we are dealing with health concerns. For sexual health to be attained and maintained, sexual rights of all persons must be respected, protected, and fulfilled. So part of our well-being is not using coercion, that we're engaging in consensual acts if we're engaging with others, that we are assuring that we're attending to not just the physical, but the mental and emotional and social well-being as well. So we are going to move on to our first quiz. I know, Tanya, you had asked questions about this. So if you're not familiar with Poll Everywhere, it is a program that allows you to either go to the website listed there at the top. There will be a few poll questions throughout the presentation. And the place that you'll go to answer these questions is the same every single time. So I do want to just let you know that, so you're not feeling like you have to, figure out where you need to go or what text you need to send to what number. This is a way that you can log in to the poll and continue to participate in it throughout the presentation. So you'll see there at the top that you want to use the code 37607 and send it. I'm sorry, that's the number you'll send it to. The code is Amy Crowley 217. Or you can use the website polllev.com/Amy Crowley 217. And as you access that, you should be able to see the poll questions that as they come up, I will verify on my end that it is working. So my Poll Everywhere is open. Anyone who is accessing it, please let me know if you are able to do so or if you're encountering issues. What should occur, if this works the way it's supposed to, is that you should be able to send in your responses, and then when I close the poll, it will give me the answer to everything that, or all the responses that have come in. So anyone that can let me know if it's working or not working.
Can you repeat the website again?
Sure, it's POLL, like the word poll, and then EV, E as in Edward, V as in Victor.com/Amy, spelled AMI, Crowley, CROWLEY 217.
It's working.
Good, thank you. All right, so I will just give it another minute.
It's working. Thank you, Tanya, for the text message.
Okay. See if everybody's been able to. So true would be a response of A and false would be a response of B to the question, no one will ever love me because I have a stoma. All right, looks like we are getting some votes in here.
For example, every night
All right. Okay. So I did just now realize that I actually am presenting on 2 different computers, so I cannot show you the answers. However, I can tell you that so far the responses show that you are correct. False is the answer to this poll question. So it is a myth that with a stoma, you are not considered lovable. That no one will want to be with you because you have a stoma. It'll be a deterrent from being in a relationship. And yet we have no medical evidence that supports that at all. So you'll find that these questions are pretty obvious, but I still want you kind of thinking about the topics. So we'll move on to sexual response. So I wanted to provide a little bit of basic education on sex and sexuality here at the beginning. So I want to start with sexual response. And sexual response consists of 3 phases. We have sexual desire, sexual arousal, and orgasm. And so I'm going to speak about each of those a little bit more in the coming slides. For now, I just want to say that the phases of response, of sexual response, are the same whether you're stimulated by a partner or by yourself. Your body will have similar responses regardless of what is causing the stimulation. And yes, sex can be enjoyed in either way. Various hormones and 2 different sets of nerves control the way our bodies respond during sexual activities. One set of nerve controls the between the ears part of sex. So that would be our brain and what's happening in our brain, how we're interpreting the experience, and therefore our body responds accordingly. The other part, or let me back up for a minute. So our brain also controls the emotions, how we interpret our sensations, whether they're enjoyable or not enjoyable, and all of the changes that are occurring that then give us feedback on our response. So while our body is responding to sexual stimulation, we're now receiving that information, and from there, our body's responding again. And so whether you're alone, you're with a partner, your body's going to have some response, and your brain's going to be constantly taking in that information as data to input, and then responding or having your body respond in a certain way. For those that have had sexual experiences and experienced sexual response in the past, you might feel like a lot of it is very automatic, and the brain does that for us. Sex is necessary to the human race in order to continue to procreate and keep the human race going. So it's important that our bodies don't shut down during one of these very vital natural acts that are necessary for survival. So in many ways, it is involuntary in that you're not having conscious thought processes about every single thing you're going to do, but it's not so unconscious that you're not in control of it. The other set of nerves that control our response is the between the legs response. And this is a little different than the between our ears response, and that the part that's between our legs is our body's ability to have these physical changes that our brain is asking for in response to our sexual stimulation. It controls the flow of blood and activates the muscles that are connected to our genitalia and our sex organs. So it's important that we have a flow of communication between our brain and our body so that it is able to actively receive the messages that our brain is sending and that our body can then respond to. Because though sex is something that we can engage in for the purposes of procreation, it's also something we can engage in for fun. So our body's going to have this natural drive and want to make sure the event occurs. And whether that's our intention to procreate or just to have a little bit of fun, you know, our body's going to respond the same way. So next, I want to talk a little bit about sexual desire. So sexual desire is exactly what it says. It's the yearning and wanting for sex. Being turned on, being excited, being horny, all of those things fall under sexual desire. The restless feeling and emotional tickle that we get when we're sexually stimulated, the desire to enter into a sexual activity, All of that can be triggered or potentially blocked by many of our senses. So we have all of our senses are activated during a sexual encounter that we may have. For example, sight and smell are some of our stronger senses, only second to touch. So touch is going to be our primary sense activated during sexual interactions. Our emotions are part of this process as well. Might be thoughts, they might be fantasies, they might be dreams that we are engaging in internally that are motivating us to act and respond physically. We also have hormones that are at play. So this includes the male identified hormone of testosterone and the female identified hormone of estrogen. Now, kind of some basic biology is that everybody has estrogen and testosterone. We just have them at different levels. Those with higher testosterone levels appear and behave in many instances more masculine, and those with higher estrogen levels appear and behave in ways that are much more feminine, according to social constructs of what is feminine and what is masculine. It is important that we have adequate levels of both hormones in order for sexual functioning. So we never want to be in absence of one or the other, regardless of how we may identify our gender. After you feel desire, your body enters into the second phase, which is called sexual arousal. So sexual arousal is when you feel excited, passionate, stimulated. All of these are very active words. They're considered very positive in the sense of forward movement versus stagnant or negative and backwards movement. Your heart rate and your breathing are going to speed up. Your muscles throughout your body, and specifically in your sex organ, are going to become very tense. Blood is going to rush to your sensitive areas, which are many throughout our bodies, and they do differ from person to person. In general, we do identify genitalia as some of the more sensitive areas of our body. So we find that men will experience erections, women's vaginas will expand and get moist. Both of these behaviors welcome the sexual activity to occur. Each person's level of sexual desire and arousal does vary, and it varies throughout an experience and throughout their lifetime. So you won't necessarily have the same level of desire and arousal from one sexual experience to another, even if you're participating in those sexual experiences independently or with the same partner. So there's always other factors that are impacting your sexual desire, your sexual arousal, and your interpretation of the stimulus that you're receiving either from yourself or from your partner. Some people may not experience what they consider to be a lot of sexual desire or sexual arousal, and they can still participate in very fulfilling sexual activities. So you don't have to have these to a very high level in order to participate in sexual activities. Next is the orgasm. So for many, they think that this is a myth. It doesn't occur more often in women, when in reality, orgasms can occur regardless of the gender, regardless of the type of stimulation. Individuals reach orgasm through different levels of desire, arousal, stimulation, activities, and what works for one may not always work for the other. Orgasms are complex. They do require both the signals that are occurring in your brain between the ears and those that are receiving those signals from your brain between your legs or in your genitalia. So it isn't as automatic as we might think. It's quite a complex process for your brain and your body to complete. And it's made up of pleasant sensations, muscle contractions, and a release in your sexual organs. Clinically speaking, an orgasm is simply the sudden release of pooled blood in the sex organs and tension in the muscles. It does not require ejaculation in either the male or the female. So I do want to clear that up, as that's a myth that many people have, is that they must ejaculate in order to have had an orgasm. The orgasm is the actual tension being released from the muscle group that oversees your sexual organs. It's kind of like if you sneeze and you're preparing for that sneeze and you feel it all building up, and then all of a sudden you sneeze and it's over with. You know, you don't necessarily have to have discharge from your nose in order to say, hey, I just sneezed. So the same would hold true for your sex organs as well. It's just that release of that muscle tension that actually classifies it as an orgasm. Two people will experience this very differently, and an individual may experience an orgasm differently depending on their partner, the type of stimulation, whether they're alone, their level of sexual desire, and their level of sexual arousal. The important part for reproduction is that oftentimes an orgasm, the release of the muscles, is what's necessary for semen to be ejaculated from a man's penis into a woman's vagina for fertilization. So there is a purpose in the actual act of an orgasm. However, it's possible to get pregnant without the male ejaculating, and it's not necessary for ejaculation for there to be an orgasm. So the sex between the legs nerve set is what really controls what's happening during your orgasm. You know, how those muscle groups are responding throughout the orgasm may determine whether or not there is ejaculation. And of course, in those cases where we're looking for fertilization, procreating, then the ejaculation part is very important. So now I want to sort of fine tune our discussion and move a little bit towards the group that we're with tonight, and talk about how illness and human sexuality, health sexuality intersect. So I'll go over a few things, and I know, Nicole, you have some comments that you want to add to this particular slide as an ostomate yourself. So I will say that illness can be sudden, it can also be prolonged, and it can be longstanding. It is important to recognize that with a sudden illness, an individual may be feeling a variety of emotions about their illness, including shock, anger, resentment, anxiety, and even depression. All of these can adversely affect someone's sexual desire and functioning. Many illnesses can even cause disfiguration and force a person to deal with radical changes in their body image, how they view themselves, how they think of themselves as sexual beings. Many people are left wondering, how could anyone possibly find me attractive if I now have a stoma, if I now have a bag, if I now have these additional considerations? Society as a whole does not do a very good job of presenting a variety of physical presentations of individuals that is considered attractive or sexual in nature. And illnesses are one of those areas that are not addressed when it comes to sexuality. Serious illness can put a strain on loving relationships. A partner may be forced to become nurse, cook, maid, and caretaker, as well as lover. So it causes some role shifting for the individuals that are not only experiencing the illness, but the loved ones that are around them. A caretaker of an ill person may worry that the sick partner is too weak or fragile for sex, or maybe too concerned with the illness to want any kind of sexual contact. Still, many couples do enjoy loving, full relationships despite having a serious illness. Maintaining a healthy and satisfying sex life. It's important to do so in order to increase personal happiness and satisfaction for those who are chronically ill or suffering from a variety of medical conditions. Dr. G, as we call him, has explained that the real questions that sick people and their partners have about sexuality are too often ignored by medical professionals. It's out of their purview. It's something that they are not well trained in. These may be questions of simple mechanics. What positions can I get into now that I've lost a limb? Maybe questions of function, like will my partner or will my genitalia still work now that I have a spinal cord injury? Will I still feel the same sensations that I felt previously when my partner touched me? They may be questions of attractiveness. Will my partner still find me attractive now that I have an ostomy? Counseling is a wonderful alternative to exploring such questions, especially when medical professionals cannot or will not address these concerns. People who are ill have the same sexual needs and desires as anyone else. In the past, these needs have too often been neglected, not because the individuals that are ill are not interested in sexuality, but because they don't have good sources of information on how this is actually going to look. How are they going to function? How are they going to be able to still work on healthy living while also exploring sexuality and meeting their sexual needs? I've had clients who have discussed how medical professionals have told them, you know, that's the last thing that should be on your mind. When I'm over here saying, really? Because I'm pretty sure it's the first thing on a lot of people's mind. So it is really important that you have a source of information that's providing accurate feedback, but also supportive feedback for you. This is changing a bit. We are seeing sexuality discussed more amongst medical professionals. There's still a lot of that conversation that's very clinical in nature and not necessarily attending to the romance or relationship side of sexuality. And we're still missing some information on some illnesses, some diseases, some disorders, and how that affects sexuality. Unfortunately, one of the contributing factors to the lack of information that we have is individuals who are currently experiencing those illnesses and diseases being willing to come forward and share their stories and share their questions and share their experiences so that it can be documented and researched. So it's a field that's constantly growing. And our hope is that, you know, we will continue to have data come in so that we can expand our knowledge set on this topic. Nicole?
Yes, thank you, Amy. I think you were spot on with what you just said. I mean, I think I can speak for the group saying that being chronically ill is already enough to deal with. And I know that I personally struggled for a while to be able to communicate my condition, you know, especially with the stigma that comes with it, you know, to overcome that and be able to tell my partner that I like so much of what I'm going through. And you know, it is essential. It's if you're in a relationship with someone, you have to build that trust regardless of what you're going through. And I think that this is kind of where the conversation starts.
Excellent. Thank you, Nicole. All right, so here we are at our next poll question. So very quickly here, sort of the same instructions. We have the same website, or you can respond again to that same text message thread. This time, our question is, you can get pregnant with a stoma. So that would be A for true or B for false. So I will give you a moment to get our responses in here. Looks like we have some coming in already. Wonderful. All right. So yes, 100% of you are correct. You can get pregnant with a stoma. So there is no documented medical information that says that having had a surgery that results in a stoma in any way affects your fertility. So do want to let you know that both men and women can contribute to pregnancy with a stoma. So we're now going to move into how we can sort of drill this down to what are some specific sexuality concerns for ostomates. You'll see there, I've included a picture. This actually was in People magazine, and we have a model who wonderfully was willing to show that she herself has a stoma, she has a bag, and yet she would be viewed as very sexual, very attractive by our culture. And so when they did a comparison, they showed her from the just below her bra up, and they showed a second picture of her from the bra down. And the ratings of her sexual appearance were higher without the bag. So she decided that it was important that she show all of her, that she wanted people to see her as more than just a pretty face, but that see her entirely and really challenge those myths about what is considered attractive and what is a sexual person. And for her, she very appropriately shows anybody can be a sexual person. So some concerns that we know come up for ostomates are, sexual relationships and intimacy are important, just like they are for anyone, and they want to fulfill these aspects of their life. This is something that should be encouraged pre and post operatively as the ostomate feels comfortable doing so, and that's comfortable emotionally and physically. There is a period of adjustment that comes after the surgical procedures, and some ostomies can affect the relationship a little bit more than others. None of them are complete deterrents from sexual behaviors. One of the key components to sexuality, and even more so for those with illnesses, is communication. And so we're going to talk a good bit about communication. It's going to come up multiple times, but communication is key in reestablishing sexual expression and intimacy between two individuals. Ostomy surgeries can also present concerns for single individuals. When you choose to tell someone special that you have a stoma, you may carry some concerns about how this might affect the relationship. When's the right time to tell, what you should tell, how you should tell it, and do you all of a sudden become the source of information for your partner? So all of these can come up as concerns for single individuals as they're undergoing surgery and recovery from surgery. So, Nicole?
Yes, I did say I had a lot to say about this slide. I think time for adjustment is so easy to overlook, but time for adjustment is so important. I mean, it's going to be hard to enjoy yourself intimately with a partner if you haven't given yourself the time to heal and adjust to your new body and to talk to people about, how you can go about this. Even before my surgery, like I said, I started working towards accepting this, and I spent time following Ostomates on social media. There is quite a big population out there of Ostomates that speak out now. And it was something I didn't have that experience when I was 13. Social media wasn't as much a thing. But now if you go on Instagram and you look up #Ostomy, you're going to get thousands of results. And it's been really great for me to be able to see and just keep hearing people's snippets of their experiences and sharing that form of communication without having to directly reach out to people and ask them questions. So I would say that, I understand that not everyone had the luxury that I have in being able to plan my surgery, but I wanted to make the most out of it. So I actually, Amy, I'm going to tell them is that this is something I haven't told anyone, is that I actually planned a before and after photo shoot before my surgery and then a couple months after my surgery as a way for me to celebrate what I've already gone through and have those memories to look back on. I actually didn't have any photos of me as an ostomate when I was younger. And so I wanted to have the before and afters, and I've kept them to myself. It's been part of my adjustment. It's been part of accepting what I'm going through. And being single is a new challenge for me as well that I actually didn't know I was going to go through with this. I was in a long-term relationship, and for unrelated reasons, we broke up just a few weeks before my surgery. And I found myself having to navigate being newly single and being a new ostomate. And it was a completely different challenge. And it's not easy to be vulnerable with people you don't know or you're trying to get to know. But I think there is a superpower that lies with having an ostomy, and it's that it's really great at sorting out the good apples from the bad ones.
Absolutely. And I think you wanted to take the lead on this slide too, that you really had a lot to say here.
Yeah, I mean, discuss any sexuality concerns with your partner. I really feel as though you would want to have that conversation before you get to the bedroom. It's not so much fun to have to backtrack if you're not pretty transparent from the beginning. I have had so many friends that have been really interested in my experiences and have asked me questions. I think that that's something that in order to discuss these things with your partner, you have to be able to be honest with yourself. So I would say take a step back and see how are you able to communicate in conversations with individuals that you already love, that you already know, versus putting yourself out there to someone you may not be ready to be vulnerable and then to possibly be rejected, because people are imperfect. And they may not accept that, and that's fine. That's your rotten apple. So things to talk about, physical limitations, pain if present, fears or insecurities, mutual expectations, sexual activities you like to do or you don't like to do, and anger, guilt, resentment, other emotions, they all come into play because we're emotional beings, and the condition we have, it is tied to emotions, and sex is emotional. So these two kind of collide right here. And so I really think that, like Amy said, communication is key. You need to start opening up conversations with individuals to start to feel comfortable to have that conversation with someone that you are interested in, and they have, they don't know you or your condition.
Yes, absolutely. And thank you so much for that, Nicole. I also am realizing that we are running a little low on time. So I want to be mindful of that. And I think I'm going to go ahead and skip some of our poll questions just so that we have time to get to the content of the presentation. So our next slide is looking at skin to skin or body contact. And body contact during sex is one of those things that's like, well, of course that's going to happen. But we want to be a little more specific when it comes to ostomates and say, it's not something that you have to avoid. It is okay for you to have body contact. In general, body contact is not going to hurt your stoma. Individuals with abdominal ostomies just need to work on maybe varying their positions. If the pouch or stoma seems to be in the way of maybe how you've previously had sexual contact. For people with abdominal ostomies as well, the type of intimate clothing that you wear may need to change. So you want to have something that's comfortable and isn't going to pull or tug or be restricting unless it's more comfortable for you to be restricted in that area. So some individuals may prefer sort of more open lingerie, maybe panties or teddies that may not necessarily require as much work or need to be removed for fear of upsetting their stoma, moving their stoma that may cause discomfort or pain. And some may actually want to wear a wrap or a cummerbund around their abdominal area so that they can hold things a little bit more secure in their midsection. That way the pouch doesn't accidentally get hit or, knocked around, which can, contribute to concerns about whether or not the bag may leak or cause physical discomfort during sex. And again, specifically looking at sort of that skin to skin physical contact aspect of our physical touch. Nicole, I think you had something you wanted to add here as well.
Yeah, I mean, I think the big point of this is to take it slow and see what works for you. I did a lot of research into intimate clothing and positions and things like that. And I really think, take what's recommended to you and take pieces of that and apply it to you how you'd like. Take your time exploring with your partner and just communicate with them.
Yeah, and I like your use of the word explore, because that's something that is part of sexual advice that I give to individuals I work with, whether they're there for sexual dysfunction or sexual concerns. And it isn't necessarily about those with health issues, but in general, we need to learn to explore. We need to explore ourselves. We need to explore with our partner. And we can learn a lot from doing so. All right. So we did want to sort of address some of the potential problem areas that ostomates may encounter and just sort of put out some education about those. So, the first time that you're intimate post-surgery, things may not go perfectly, and that's okay. Part of that communication, as Nicole has spoken about, is really making sure that your partner knows that this may not be your normal level of functioning because the experience is now different for you and it's new for you, whether you're with the same partner or not. Some individuals may have difficulty getting and maintaining erections as their body could still be healing from their physical surgery or learning to function with so much of their body's energy going towards their body functions, their digestive system, and how the pouch operates for them, whether or not, they're sexual before eating, after eating, how long after eating. Those are all things that we have to learn, and we'll learn over time at how they impact our sexual functioning. It can be a little upsetting to feel like, you have to sort of start from scratch again. I personally would say enjoy it. It's like having, a sexual change that only comes typically to teenagers. So now you have an opportunity to get it again as an adult, and you can go back to those exploration. You can go back to the learning things again, and not see it as a deficit, but see it as a welcome opportunity to learn more about your own sexuality as well as that of others that you may be engaged in sexual behaviors with. You may have some worries or fears about your ability to perform. You may be worried that your stoma or pouch may offend your partner or be unattractive to your partner. You may be worried about leakage of your bag, the pouch falling off, maybe even some odor. And we also know that there's a lot of emotions tied into this. And one of the more common ones is depression. Can I do this? How do I do this? Am I okay with, my new appearance? How do I keep up my physical stamina now that my body's, learning to recover from my surgery or learning to adjust to having a pouch and a stoma? It's also important that you look at your medications and understand the medications that you're on, understanding some possible side effects of your medication. Medications do have sexual side effects. So being aware of what may be medical versus what is a reaction to your body's being post-operative. And so we want to not discount that our medications can also contribute to our experience of sex and sexual encounters. Nicole, I think this was another slide that you wanted to talk about.
Yeah, no, but I think you spoke on that perfectly, Amy. I'm okay with us moving on.
Okay, wonderful. All right, so looking a little bit at some common reactions to ostomy surgery and whether or not these can interfere with the ability to share a sexual experience with another person is, we have some common emotional reactions, that embarrassment, that shame, that fear of pain, leakage, rejection, being naked in front of someone, anger, depression. And a lot of these are the same for non-ostomates. So I don't want this to be like, oh, these only happen to those that have had ostomy surgery. No, that's not true. In fact, being naked is one of the most common fears that I see when I work with individuals around sexual issues. And they come from all walks of life, not just those with medical concerns. Physical changes that are caused by ostomy surgery, because of where ostomy surgery takes place around the pelvis, some or all of your organs may be removed. And so it makes sense that you may have some difficulties in sexual functioning, especially at the beginning. As you learn to navigate your own body, your own recovery from surgery, you also will learn to navigate your sexual functioning and interactions with others. It does change for men versus women. And it changes based upon the type of ostomy operation that you've had. So an ileostomy, a colostomy, urostomy, all of those are going to result in a different experience for individuals based upon not only the medical procedures they've had, but also the placement of their stoma in their bag and how they accommodate for that. So not all intimacy must include sex or penetrative intercourse. And this is, I've kind of put on the side there, this is because Dr. Crowley says so. This didn't come from another source, but I think it's really important to, go back to what I had said at the beginning, I've kind of mentioned throughout, is that sexual functioning isn't just about what you do with others, but it's also how you perform when you are with yourself. And so if we are being intimate, but we're not having sex with a partner, or we're not engaged in penetrative intercourse alone, we need to understand that other options include masturbation, mutual masturbation, oral sex, and even close physical contact, such as cuddling. And then I love the idea of meeting of the minds. And so even when we're not physically feeling like we can be sexual, we can still connect with others on an intimate level by using that organ, that between the ears organ that has so much of an impact on our sexual drive, and really connecting emotionally and mentally with someone else. All right, so preparing for the bedroom. Nicole?
So I did want to take over this slide because there are so many different things that can be recommended about what to do, or I do this, or you should do that. And I think really what it's about is that you're prepared and your partner's prepared. So if you're getting ready to be intimate, awesome. And I would dare say that if you've gotten to that point, then you probably trust your partner and you've communicated your situation and you allowed them the opportunity to ask questions and understand. And if you haven't, I strongly suggest you take a few steps back and have that conversation with them prior to taking your clothes off. I mean, if Jack or Jill, quite frankly, if they don't care enough to look past your condition, they don't deserve to get in your pants. So don't give Jack or Jill the opportunity to walk out while your clothes are off. This is your ostomate superpower. So, being single, this step is very intimidating, and you may not love your new scars or your new body. You may be self-conscious of the weight you've lost or the weight you've gained, and, your bag being in the way. But there's a number of so many of reasons why, when it comes down to it, if you've chosen the right person and you've had these conversations, then it shouldn't give you too much anxiety to take that step forward. You may want to keep your shirt on the first time. You may want it you may want the lights to be off. I do recommend, actually, the one thing I would really say is you probably want to empty your bag, but it depends on when was the last time you emptied your bag. I do kind of want to move things along for the sake of time, but I also say it's really about your preferences. Take what's recommended and piece it together for yourself.
Excellent. Thank you, Nicole. So we have some additional preparation here. The prior slide listed a few things. This is sort of some other things. We've covered most of these during our talk already. They're just things that we really wanted to highlight. I included some graphics there on various sexual positions that some may find more comfortable than others, depending on the placement of their ostomies. And Nicole, I think you had something you wanted to add here as well.
Yeah, I did, but I kind of added it on the last slide. So I'll let you keep going.
Sure. So the one thing I do want to highlight before we move on is that there are many items available that are specifically designed for ostomy coverage and intimacy that you can purchase online. So don't feel like there's nothing out there, or you have to, finagle something yourself. Go search online and find out what's out there, what's available, and what might work for you. And as Nicole said, it's what works for one won't work for the other. So you might need to do a little bit of experimenting around and exploring, and you might be like, hey, I can do that. I can make that myself. So I can even remember Nicole was having conversations about you making some of your own pouch covers yourself. There's some great bag covers out there, I know, but sometimes you just want, your own design or your own fabric or what fits right for you. So get creative with it. So I did just want to take a moment and talk about gender and sexual minorities that are also ostomates. And so the reality is that surgery like this is going to impact anyone. It doesn't matter what their socioeconomic status is, their race, their ethnicity, their gender, their sexual orientation, their ability level. An ostomy is an ostomy, and it's going to have an impact. For some individuals, they may have surgically have their rectum removed. And so if they are a gay man, this may pose some difficulty with their preferred method of sexual intercourse. So we do have to look at what are some alternatives and how can the same sexual desire, sexual drive, sexual needs be met now that we've had some surgical interventions that we are working with. Hormone treatment can also impact one's sexuality. And again, just reminding you of the importance of your support system, your medical team, your partner, a counselor, and there are support groups. I was doing some research and I actually found a support group for gay and lesbian ostomates. And so I know it's out there. We're meeting online now. So our ability to access some of this has increased during COVID because we're getting so used to functioning online. So whereas a support group may not be in your local area, you may still be able to access a support group online. So really want to encourage you, regardless of your gender identity or sexual orientation, to recognize that there are options out there for supports, that you're not alone, that there are others who are going through exactly what you're going through, which is why I had Nicole join us today, because I knew she would be able to give that personal account. So in closing here, I do want to kind of just add this last little tidbit, if you will, which is laughter is the shortest distance between two people. So, though it is important to have some of these tough conversations, though it is important to, be your own advocate and talk to your partner, we also don't want to lose sight at what connects us as humans. And sometimes it is that meeting of the mind. Sometimes it is just laughing and hanging out. And so I wanted to add that here at the end, and we are actually, I do have references included for anyone who wants those. They're listed on the slides. But Tanya, we are ready for questions. I know we're over time, so if individuals need to go, I understand. I'm free to stay and answer some questions. I'm imagining Nicole can hang out for a little bit if there are questions for us.
Yes, so I wanted to go ahead and say thank you because this was extremely informative. I think it was very necessary as well. This is often a topic that sometimes when they're hospitalized, it's something that runs through their mind and they're just not sure how to bring it up. And they go home, and once they adjust at home and they're ready to begin the activity, they don't know where to go, they don't know who to ask. So this was very necessary. I wanted to piggyback off something that you had mentioned. There is different companies that create kind of like a lacy bandeau. It wraps around your abdomen and it kind of conceals the pouching systems. We did go ahead and put the links in the chat. So if it is something that you are interested in, you can always go ahead and check out their website. They have a lot of different options and they're very cute. Before you begin any type of activity, it's very important to speak with your surgeon before to get the clearance. But once you are able to do so, you can always begin maybe slowly or at your own pace, but it is a good idea to start. Very important. I've gotten the question, I think, like once in the 2 years that I've been here, but nothing is to be inserted into the stoma. There's no nerve endings there, so it's not like you'll get any type of pleasure, but please do not insert anything into the stoma at any time. And we can go ahead, if there is anybody that has any questions, you can go raise your hand and we'll go ahead and answer them if we receive any. But the presentation was very informative. I think that you answered a lot of questions. I had some questions that you were able to answer as well. So that was excellent. Thank you.
Absolutely. And, you know, we're glad to be here. As I said, our contact information is also listed on the slide. So please feel free to share if anyone would like to reach out to us separately, you know, or with their own questions, or maybe even in reflection over time. You're like, you know, I probably should have asked this during the presentation. You know, and Stephanie can attest to this. I am always about being open and available and willing to have discussions and answer questions to the best of my ability. Obviously, Nicole has a very unique perspective on this. And, you know, she's able to speak from a firsthand perspective that I cannot. But certainly as a sex positive therapist, I do a lot of research on sexuality and do my very best, I'll say, to make sure that I'm keeping informed of some of the potential challenges that individuals might face and how I can best support them. So I'm certainly glad to be a resource either now or at some point in the future if others come up with questions.
I had one comment. If you can please go ahead and send the link of the gay and lesbian ostomy support group. That's
Sure.
very important, very unique. I love the idea. So if you could please put the link so that everybody that is interested in that specific support group can go ahead and join that as well.
Absolutely. Let me maneuver my computer. It's one of the downfalls to working on multiple computers.
Well,
All the screens, and I'm like, I gotta move things around. So
I had two open at the same time. I'm trying to focus.
Yeah.
All right. So we haven't gotten any questions. I think it's just because you had great information. You answered, someone wrote that they had a question, but that you answered it during your presentation. So thank you for that. Someone else mentioned that you had an amazing presentation, and thank you for the great information. So I wanted to thank you both, Dr. Crowley and Nicole, for taking the time and really shedding more light on this particular topic, sharing your experiences on this topic as well, because like you had mentioned before, it's something that's not talked about enough. And it does play a major role in relationships, whether you're single or not. Very important. So to finish this support group, I did want to make a couple of comments. So for our next English support group, it will be held on March 1st at 6 p.m. Eastern time. We do have an amazing speaker lined up, so I know you guys will enjoy it as well. If you or anyone you know is a Spanish speaker, on Tuesdays, the second Tuesday of the month, we do have a Spanish Ostomy Support Group. It will be held on February 15th at 6 p.m. Eastern Time as well. The speaker will be Dr. Christine Rojas, who will be speaking on sexual health and intimacy for women with an ostomy. So again, in the month of love, perfect timing. And please remember that these ostomy support groups, whether it be in English or in Spanish, they're not just for ostomates, but they are for those that maybe care for someone with an ostomy, or maybe someone that will be having an ostomy created in the future. There will be lots of wonderful information, so please don't miss out. If you are interested in being reminded about these meetings, please write your email in the chat room and we will send you a reminder. Or you could go onto the website on umiamihealth.org and click the Ostomy Support Group tab, and all the upcoming events will be posted on there. And I wanted to take one last time to thank the both of you and taking out time of your day to give all this great information regarding the ostomy and sexual health, mental health. It was wonderful.
Our pleasure, our pleasure. Thank you so much for having us. And like I said, anyone that finds they have questions later, please don't hesitate to reach out.
Thank you very much, the both of you.
Thank you, guys.
Have a great evening.
Have a wonderful evening.